Hello everyone! We are the Group 1. Before we dive into our report, let me first introduce myself. My name is Mark Juvenaraiso, and today we will be discussing the introduction to critical care. So our presentation will cover several key areas that related to a critical care nursing. So the first is scope of critical care practice. We will explore the range and boundaries of a critical care practice, including the development of critical care nursing practice, education, and professional activities in the Philippines. This section will highlight how critical care has evolved over time and the role of education and professional growth in enhancing a nursing practice. Next is critical care body of knowledge. We will discuss the comprehensive body of knowledge that supports critical care, including the theories, principles, and the best practice essential for providing highlight quality care in intensive settings. Next is critical care competencies. We will outline the core competencies required for critical care nurses to effectively manage complex patient condition and environments. Next is professional organization. Finally, we will talk about the professional organizations dedicated to critical care, their importance, and how they contribute to the advancement of the field of when regards on critical care nursing. But before we start, we get we get have a little bit defined what is critical care is.
Critical care is often referred as an intensive care. It is a specialized branch of medicine dedicated to the management of acutely ill patients with life-threatening health conditions. It involves the provision of comprehensive medical and nursing care in a highly monitored environment, utilizing advanced technology and a multidisciplinary approach. So the field of critical care, it has evolved dramatically in recent decades, driven by the advancements in medical technology, pharmacological interventions, and a deeper understanding of critical illness. Critical care encompasses a wide range of medical specialties. These includes the following. We have first the cardiology. It is where you are going to manage patients with heart failure, arrhythmias, and acute coronary syndromes. In pulmonology, we are going to care for patients with respiratory failure, pneumonia, and acute respiratory distress syndromes, or what we call the ARDS. Next in line is the neurology, providing care for patients with stroke, brain injury, and seizures. Next is surgery. It is where we are going to manage patients undergoing major surgeries, trauma, and burns. Next is infectious disease. We're going to treat patients with severe infections, sepsis, and multi-organ failure. And lastly is the nephrology. It is where we're going to provide care for patients with acute kidney injury and requiring dialysis.
The importance of critical care in the healthcare system. Critical care is crucial for advancing medical knowledge through research and development of new treatments and technologies, ultimately improving patient care for all. Critical care plays a vital role in the healthcare system by providing life-saving intervention. ICUs are equipped to handle complex medical emergencies and provide immediate life-saving interventions. And it's improving patient outcome. Early and specialized care in the ICU can significantly improve patient survival rates and reduce long-term patients' complications. And it also facilitates recovery. Clinical care teams work to stabilize patient and support their recovery. enabled them to transition to less intensive levels of care. And then advancing medical knowledge. Critical care research contributes to the development of new treatments, technologies, and best practices for managing critical ill patients.
Hello everyone. So let's proceed to the definition and boundaries of critical care practice. Critical care practice is a specialized area of healthcare that focuses on providing life-sustaining interventions to critically ill or injured patients. It involves a multidisciplinary team of healthcare professionals working together to provide comprehensive care to these patients. The focus of critical care practice is on patient-centered care, which means considering the patient's needs, values, and preferences when making care decisions. Boundaries of critical care practice. The boundaries of critical care practice are often fluid and can vary depending on the setting, patient needs, and available resources. There are three key areas that define the boundaries of critical care practice: patient-centered care, critical care environment, and critical care nurse. So let's take a closer look at each of these areas. First is patient-centered care. Patient-centered care is a holistic approach to care that considers the patient's physical, emotional, and spiritual needs. It involves involving the patient and their family in care decisions and respecting their autonomy and dignity. This approach to care is essential in critical care practice, where patients are often vulnerable and dependent on healthcare professionals for their care. Critical care environment. The critical care environment is a high-tech environment with advanced life-sustaining equipment and technology. It is a collaborative environment where this multidisciplinary team of healthcare professionals work together to provide comprehensive care to critically ill patients. Critical care nursing is a specialized healthcare professional who possesses the knowledge, skills, and competencies necessary to provide high quality care to critically ill patients. They assume a leadership role in multidisciplinary team, coordinating care and making decisions that impact patient outcomes. The critical care nurse is essential to the delivery of critical care practice, and their expertise and leadership are critical to achieving optimal patient outcomes.
So now let's proceed to the overview of the critical care settings and patient types. So critical care settings, critical care units or the CCUs are found in the hospitals, specialized clinics, and even homes with varying types and focus areas depending on the institution's resources. Some common critical care settings include the intensive care units. The most common type of critical care unit, the ICUs, are equipped to manage patients with life-threatening conditions requiring continuous monitoring and interventions. They are often categorized based on the patient's population served, such as the medical ICU, the MICO, which focuses on the patients with medical conditions like sepsis, respiratory failure, and heart failure. And the surgical ICU primarily manages patients recovering from major surgeries or those with surgical complications. And we also have this cardiac ICU, specializes in the care of the patients with heart conditions, including heart attacks, heart failures, and arrhythmias. And the neurological ICU provides care for patients with neurological disorders such as stroke, brain injury, and seizures. And lastly, the Cardiac catheterization lab. This specialized unit performs diagnostic and interventional procedures in the heart, such as angiograms and stents. And the emergency department, while not strictly a critical care settings, but the emergency department often serves as the initial point of contact for critically ill patients. It provides stabilization and emergency care before transferring patient to the CCU if necessary. And last is the burn unit, dedicated to the care of the patient with severe burn, requiring specialized wound management. And, then let's proceed to the patient types in critical care. Critical care patients exhibit a wide range of conditions and needs, requiring a tailored approach to their management, and some common patient types encountered in critical care include the patients with respiratory failure, the patients that struggle to breathe effectively and require mechanical ventilation to support their breathing. And then the patient with cardiovascular instability, this group includes patient with heart failure, arrhythmias, and other conditions affecting heart functions. And the patient with neurological disorders, patients with stroke, brain injury, or other neurological conditions often require intensive monitoring and specialized care. And we also have this patient with sepsis. This life-threatening condition arises from the body's overwhelming response to infection, requiring aggressive treatment with antibiotics and supportive care. And the patients with trauma, patients who have suffered severe injuries such as those resulting from accidents or violence require immediate care and may need surgery, blood transfusion, and other interventions. And the last is the patient with multi-organ failure. These patients experience dysfunction in multiple organ systems, requiring complex management and often necessitating mechanical support.
In addition to a scope of critical care practice encompasses providing life-sustaining intervention to a patient with life-threatening condition. It requires a multidisciplinary team approach, and it's not confined in a single specialty. Critical care nurses work in various settings such as medical ICU, surgical ICU, and a specialized unit like cardiac catheterization lab. The practice involves continuous monitoring, advanced interventions, and a patient-centered care to manage conditions like respiratory failure, sepsis, trauma, and multiple organ failure.
This chapter delves into the evolution of critical care nursing practice in the Philippines, examining its historical roots, the educational pathways for aspiring critical care nurses, and the diverse professional activities that characterize this vital profession. By exploring these facets, we gain a deeper understanding of the challenges and triumphs that have shaped critical nursing in the Philippines, paving the way for future advancements in patient care and profession development. First, we will explore the historical development of critical care nursing in the Philippines. This section will trace the origins of this specialized field, highlighting key milestones and influential figures who shaped its evolution. By understanding the historical context, we can appreciate the current state of critical care nursing and its potential for future growth. So first, early beginnings, laying the foundation. Our journey begins in the early 20th century, a time when modern hospitals were just starting to appear in the Philippines. These hospitals, often established by foreign missionaries or colonial powers, introduced new concepts of healthcare and patient care. Filipino nurses, eager to learn and contribute, sought training abroad, breaking back valuable knowledge and skills. These early pioneers, like the first Filipino nurses trained in the United States and Europe, laid the foundation for specialized nursing practices, including the early forms of critical care. Second is the post-World War II, growth and development. So the aftermath of World War II saw a surge in the need for critical care services in the Philippines. The devastation caused by the war led to an increase in injuries, illnesses, and complex medical conditions. This demand spurred the development of dedicated intensive care units, or ICUs, which required specialized nurses with advanced skills and knowledge. The establishment of the Philippine Nurses Association, or PNA, in 1992 played a vital role in this development. The PNA provided a platform for Filipino nurses to advocate for improved standard of care, promote professional development, and ensure the advancement of critical care nursing practices. This period marked a significant step towards establishing a more structured and specialized approach to critical care nursing. Next is the 1970s advancements and challenges. The 1970s marked a period of rapid advancement in critical care nursing in the Philippines. The establishment of specialized training programs and the introduction of advanced medical technologies such as ventilators and cardiac monitors transformed the landscape of critical care. Filipino nurses readily embraced these advancements, demonstrating their adaptability and commitment to providing high-quality care. However, this period also brought forth challenges, including limited resources, a shortage of nurses, and the need for continuous professional development. These challenges highlighted the need for ongoing effort to improve access to resources, attract and retain skilled nurses, and ensure that Filipino nurses had the necessary training and support to excel in their field. So the last one is the 21st century innovation and collaboration. The 21st century has witnessed a remarkable transformation in critical care nursing in the Philippines. Filipino nurses have become active participants in research, innovation, and international collaborations, constantly seeking ways to improve patient outcomes and elevate the standards of care. They are embracing new technologies, developing specialized skills, and sharing knowledge with their peers across the globe. This collaborative approach has led to significant advancements in critical care practices, ensuring that Filipino patients receive the best possible care. So, the evolution of critical care nursing in the Philippines is a testament to the dedication, resilience, and unwavering commitment of Filipino nurses. They have faced challenges with courage, embraced advancements with enthusiasm, and constantly strive to provide compassionate and high-quality care. As the Philippines continues to progress in healthcare, critical care nursing will undoubtedly remain a crucial pillar, shaping the future of patient care and contributing to the nation's overall well-being. The legacy of Filipino nurses in critical care is one of dedication, innovation, and a profound commitment to improving the lives of their patients. So the next topic will be presented by Ms. Duman.
So the next subtopic for the development of critical care nursing practice in the Philippines is the education in critical care nursing. So we have an overview of specialized training and education for critical care nurses. In the Philippines, critical care nursing is a specialized field that focuses on the care of patients who are critically ill and require intensive medical attention. This specialization involves working in areas like intensive care units or ICUs, emergency departments, cardiac care units, and other high acuity settings. Critical care nurses in the Philippines are expected to have advanced clinical skills, a deep understanding of critical care principles, and the ability to work effectively under pressure. So we have here key components of critical care nursing education in the Philippines. First, we need to have advanced clinical skills. Filipino critical care nurses are trained in advanced clinical practices, including the management of ventilators, administration of clinical medications, and monitoring of vital signs using sophisticated equipments. Second, we need to have theoretical foundation. Education in critical care nursing includes courses in anatomy, physiology, pathophysiology, pharmacology, and critical care nursing principles. Next is critical thinking and decision making. Nurses are trained to assess rapidly changing situations and make quick, evidence based decisions to ensure optimal patient outcomes. Lastly, we need to have interprofessional collaboration. Working effectively as part of a multidisciplinary team is emphasized as critical care often involves coordination with physicians, respiratory therapists, and other healthcare professionals. To start with, aspiring critical care nurses begin their journey with a Bachelor of Science in Nursing, commonly known as a BSN degree. This program typically spans 4 years and serves as the foundation of nursing education in the Philippines. Throughout the BSN program, students acquire essential knowledge in nursing practice, covering a broad range of topics from anatomy and physiology to patient care and medical ethics. This comprehensive education prepares them for the diverse challenges they will face in their nursing careers. Second, we need to have licensure. Upon completing their BSN degree, graduates are required to pass the Nursing Licensure Examination or the PNLE, administered by the Professional Regulation Commission or PRC. Successfully passing this exam is a crucial step as it grants them the license to practice as registered nurses or RNs in the Philippines. This licensure is a testament to their competence and readiness to provide quality healthcare to patients. Then, we need to have postgraduate specialization. While becoming a registered nurse is a significant achievement, those who aspire to specialize in critical care nursing often pursue additional training beyond their basic RN qualifications. This specialization is essential for nurses who wish to work in high-intensity environments such as intensive care units or ICUs or emergency departments where patients require complex and immediate care. Also, we need to have critical care nursing certificate programs. One common route for this specialization is through critical care nursing certificate programs. These programs are offered by various universities and professional organizations across the country. They provide targeted education and practical training focused specifically on managing critical ill patients. This includes advanced clinical skills such as ventilator management, hemodynamic monitoring, and the administration of life-saving medications. There's also master's degree in nursing. For those seeking advanced knowledge and leadership roles within critical care, pursuing a Master of Science in Nursing or MSN with a focus of critical care is an excellent option. A master's degree not only deepens their understanding of critical care practices, but also equips them with the skills necessary for leadership positions, such as clinical nurse specialists or nurse educators. This advanced education is a key for those who aim to contribute to the development of the field or take on more significant responsibilities within healthcare institutions.
Training of nurses for critical care services. First, orientation program, preceptorship, and mentoring program. New recruits to the critical care units shall attend an orientation program and be given opportunities to work under senior staff supervision. Experienced staff in the unit should be readily available for consultation. Second is the in-service training program. The unit hospital-based training courses, workshop, seminar at hospital level, and the on-the-job training and bedside supervision. These are the available certification courses for critical care nursing. First is the Advanced Cardiac Life Support. Advanced Cardiac Life Support or ECLS is a set of guidelines and protocols used by healthcare professionals to manage and treat patients with life-threatening cardiac emergencies. In critical care nursing, ACLS plays a crucial role in ensuring patient safety and improving outcomes. Second is the Pediatric Advanced Cardiac Life Support. Pediatric Advanced Cardiac Life Support or PALS
is a specialized set of guidelines and protocols designed for the treatment of life-threatening cardiac emergencies in children and infants. It builds upon the foundation of basic life support or BLS and provides healthcare professionals with the skills and knowledge necessary to manage cardiac arrest, arrhythmias, and other pediatric cardiac conditions. Next is the newborn resuscitation. Newborn resuscitation is a critical component of critical care nursing, particularly in neonatal intensive care units or NICUs. It involves a series of interventions aimed at stabilizing newborns who require immediate medical attention upon birth. Next is the Continuous Renal Replacement Certification. Continuous renal replacement therapy, or CRRT, is a vital intervention in critical care nursing, particularly for patients with acute kidney injury or other conditions requiring renal support. Nurses certified in CRRT play a crucial role in providing safe and effective care to these patients. Next is the advanced intravenous therapy. Advanced intravenous or IV therapy is critical component of critical care nursing, involving the administration of various fluids, medications, and nutritional substances directly into the bloodstream. It plays a crucial role in maintaining patient stability, treating underlying conditions, and supporting recovery in critically ill patients. Last is stroke nursing. Stroke nursing is a specialized area of critical care nursing that focuses on providing comprehensive care to patients who have experienced stroke. Stroke nurses play a crucial role in managing acute stroke, care, and promoting recovery and preventing complications. There are also continuing professional education programs. It is a type of education that consists of updated knowledge and other pertinent information that will help the critical care nurse to attain broader understanding of critical care practice and its related field. The goal includes critical care nurses' development of skill, behavior that will help them view the critically ill persons in a holistic dimension. The updated educational components includes but not limited to the following: advanced comprehensive critical assessment, the critical care practitioner, and end of life and palliative care.
For professional activities in critical care, number one is engagement in research, current research initiatives, and collaborative research projects. Many critical care nurses participate in collaborative research with academic institutions and healthcare organizations. For publication and dissemination, nurses are encouraged to publish their research findings in local and international journals.
Continued education. Lifelong learning, continued education is essential for critical care nurses to maintain their competencies and adapt to evolving healthcare practices. The following avenues are crucial, such as formal education programs. Many universities in the Philippines offer specialized programs in critical care nursing, including master's degrees and certification courses. These programs are designed to deepen knowledge in areas such as advanced pathophysiology, pharmacology, and critical care management. Workshop and seminar. Regular workshop and seminars are organized by professional nursing associations such as the CCNAPI. These events often features expert speakers who discuss emerging trends, technologies, and evidence-based practice in critical care. Lastly, the online learning platforms. The rise of online education has made it easier for nurses to access courses and training programs, allowing for flexibility in learning while balancing work responsibilities.
Good day. Professional activities. For professional organizations, consists of Critical Care Nurses Association of the Philippines Incorporation, or CCNAPI. This organization plays a pivotal role in promoting the interest of critical care nurses. It provides a platform for networking, sharing knowledge, and advocating for policies that enhance critical care nursing practice. For certification and specialization, it includes the certification programs. It also offers certification programs that validate the skills and knowledge of critical care nurses. Certification not only enhances professional credibility but also improves job prospects and career advancement opportunities. For specialized roles, clinical nurse specialists, these nurses provides expert advice and support in specific areas of critical care. And also the nurse practitioners, advanced practice nurses who can diagnose and manage patient care independently.
Next is critical care body of knowledge. Core concepts and principles underlying critical care. Essential knowledge areas for critical care nurses. So, the term critical care body of knowledge refers to the comprehensive and specialized information, skills, and practices that are essential for providing high level care to critically ill patients. Core concepts and principles underlying critical care. The core concepts and principles underlying critical care represent the foundational ideas and practices that guide how critical care nurses deliver their care. These concepts ensure that care is comprehensive, proactive, and patient centered. Here's a closer look at what each one means. Number one, anticipatory nursing care. This involves anticipating potential complications or changes in a patient's condition before they occur. It requires proactive monitoring and planning for manage or prevent adverse events. For example, if a patient with heart failure is showing signs of fluid retention, a critical care nurse might anticipate the need for diuretics and monitor the patient's weight and electrolyte levels to prevent worsening heart failure. Number two, early detection and prompt action. Critical care nurses must identify signs of deterioration quickly and act promptly to prevent further complications. For example, noticing a drop in a patient's blood pressure and rapid heart rate, a nurse might quickly assess for possible shock and initiate treatment such as fluid resuscitation. Expertise. Expertise involves having advanced knowledge and skills in critical care to provide high quality care. Example, a nurse with expertise in cardiovascular care might manage complex cases like ventricular arrhythmias using specialized knowledge to adjust medication and treatments effectively. Number four, supportive care. Providing care that addresses the patient's physical, emotional, and psychological needs. Example, in addition to medical intervention, a nurse might offer comfort, measures, and emotional support to a patient recovering from surgery, ensuring their overall well being. Number five, communication. Effective communication with patients, families, and the healthcare team is crucial for coordinating care and ensuring all parties are informed. Example, a nurse might explain the purpose and potential side effects of a new medication to a patient and their family, ensuring they understand the treatment plan. Number six, collaborative practice. Working together with other healthcare professionals to provide a comprehensive care. Example, a critical care nurse collaborates with doctors, respiratory therapists, and dietitians to develop holistic care plan for a patient with multi-system failure. Number seven, prevention or infection implementing strategies to prevent infections, especially in vulnerable critically ill patients. Example, following strict and hygiene protocols using aseptic techniques when inserting intravenous illness to prevent hospital-acquired infections. Number eight, crisis intervention and stress reduction, managing acute crisis effectively and providing support to patients and families to reduce stress. Example, during a sudden cardiac arrest, a nurse performs CPR, uses crisis intervention techniques to calm and distress family, explaining the situation and the steps being taken. And number nine, ethical principles. Adhering to ethical standards, including respect for a patient autonomy, beneficence, non-maleficence, and justice. Example, If a patient's family decides to discontinue life support, a nurse respects their decision while providing compassionate care and addressing any ethical concerns.
So the next is essential knowledge areas of critical nurses. Essential knowledge areas for critical care nurses are the core competencies and expertise needed to manage complex and high-risk patient situations effectively. So here is an overview of knowledge of areas of critical nurse. First is the patient assessment and monitoring. Continuously assessing and monitoring a patient's vital signs and clinical status to detect changes and guide treatments. So for example, regularly checking blood pressure, heart rate, and oxygen levels to ensure a patient's condition is stable and adjusting treatment as needed. So second is cardiovascular care. Managing patients with heart conditions, including monitoring heart function and administering medication. Example, managing a patient with acute myocardial infarction by administering thrombolytics and monitoring for signs of complication. Third is respiratory care, so providing care for patients with respiratory issues, including ventilator management and oxygen therapy. Fourth is the renal and electrolyte management, monitoring and managing kidney function and electrolyte balance in critically ill patients. Next is the neurological care, assessing and managing neurological conditions, including monitoring for changes in consciousness and neurological function. Example, performing regular Glasgow Coma Scale assessment on a patient with a traumatic brain injury to detect any changes in their level of consciousness. Six is the infectious disease and sepsis management, identifying and managing infections and sepsis, including administering antibiotics and monitoring for signs of systemic infections. Example, initiating broad-spectrum antibiotics and fluid resuscitation for a patient presenting with signs of sepsis. Next is trauma and emergency care, providing immediate care for trauma and emergency situation, including stabilizing patients and managing critical injuries. So for example, performing rapid assessment and stabilization of a patient with multiple fractures and internal bleeding following a car accident. 8. Pharmacology and medical management. So understanding and administering medication safely, including dosage calculations, side effects, and interactions. 9. End-of-life care and ethical issues. So providing a compassionate care at the end of life and addressing ethical issues related to patient decisions and family support. 10. Advanced cardiac life support and basic life support or BLS. So performing life-saving interventions in cardiac emergencies, including CPR and advanced cardiac care. For example, administering CPR and using defibrillation techniques during a KUDLU situation for a patient in cardiac arrest. The last is the patient and family education. So educating patients and their families about their conditions, treatments, and care plans to ensure understanding and adherence. For example, teaching a patient with diabetes how to manage their blood glucose levels and recognize signs of hypo or hyperglycemia.
The key competencies required for critical care nurses are the following: proficiency in equipment, skilled in using and troubleshooting advanced medical tools like ventilators and monitors for optimal patient care. Second is the patient assessment. It is the ability to recognize changes in a patient's condition by interpreting vital signs and lab results in real time. Next is medication administration. Knowledgeable about various medications, including dosages and side effects, ensuring safe and accurate delivery. Next is the critical care procedures. Trained in performing essential procedures like intubation and central line insertions are following established protocols to ensure safety. The fifth one is the effective communication. Clear and empathetic communication with patients, families, and the healthcare team for the coordinated care. Next one is the critical thinking. It is the ability to think quickly and make sound decisions in stressful situations to provide timely care. Next one is the team collaboration. Work closely with various healthcare professionals to create and implement tailored care plans for patients. The last one is the continuous learning. It is a commitment to ongoing education and training to stay updated on best practices and improve care quality.
So critical care competencies. So the first one is the technical skills. Technical skills, it is ability to use the equipment, its arterial lines, and cardiac monitors effectively. So the first one is the ventilator management. So it is a skill in setting up and adjusting mechanical ventilators as needed. So the next one is the emergency procedures. So proficient in performing critical procedures like intubation and central line or the central line placement. And the last one is the pharmacology. So it is a knowledge of administering drugs or medications, including intravenous, orals, and sedatives. So the next one is the clinical skills. So the first is the assessment and diagnosis. So it is capable of conducting thorough assessments and interpreting lab results to diagnose conditions. And the next one is the treatment planning. So it develops or developing and carrying out the treatment plans that meet patients' needs or in a critical thinking way. The next one is the critical thinking. It is a quick decision making and problem solution in high pressure situation. And the last one is the infection control. It is a following the protocols to prevent infections using sterile techniques. And the last one is the interpersonal skills. Under of it is the communication. So, in a clear communication with patients, families, and the healthcare team. The next one is the team collaboration. So, working well with doctors, the physicians, nurses, and other professionals to provide care. The next is the empathy and support. So, offering emotional support to patients and families during difficult times. Leadership and delegation. So, leading the care team appropriately, assigning tasks. Each of these skills is essential for providing an effective and compassionate care in a critical care settings.
So the next topic is all about professional organization in critical care. So let's have an overview. Organization supporting critical care nursing in the Philippines focus on enhancing the education, skills, and professional development of nurses who work in intensive care and other critical settings. So this organization provide a range of resources including training programs, certification, advocacy, and networking opportunities. So here is an overview of the key organization involved. So we have the Philippine Nurses Association, or also known as the PNA. The PNA is the national organization for Filipino nurses. It provides support to nurses in all specialties, including critical care. The PNA offers continuing education programs, advocacy, and professional development opportunities to enhance the skills of nurses in various fields, including critical care. Critical, Critical Care Nurses Association of the Philippines, also known as the CCNAPI. The CCNAPI is a specialized organization dedicated to critical care nursing in the Philippines. It focuses on the professional growth of critical care nurses through education, training, and research. The organization provides workshops, seminars, and certification specifically tailored to critical care nursing, aiming to improve the quality of care provided to critically ill patients. Next is the Philippine Heart Association, or the PHA. The PHA will primarily focus on cardiovascular health. It also supports critical care nursing through its training programs and partnerships. The associations provides resources and training opportunities for nurses who work in critical care settings, particularly those dealing with cardiovascular emergency. The next one is the Philippine Society of Critical Care Medicine, or the PSCCM. Although primarily an organization for physicians, the PSCCM collaborates with critical care nurses to improve patient care in intensive care units, or also known as the ICUs. The society conducts multidisciplinary training programs, workshops, and conferences that are also beneficial for nurses working in critical care settings. Next is the Association of Nursing Service Administrators of the Philippines, or also known as the ANSAP. ANSAP supports nursing service administrators and offers training programs that include critical care management. While it focuses more broadly in nursing administration, it also addresses the needs of nurses in critical care, through leadership and management training.
Role of this organization and professional development standard settings. First is the Nursing Association, or the PNA, is the largest and oldest professional nursing organization in the Philippines. It offers intensive professional development opportunities including workshops, seminars, and continuing education in various nursing specialties such as critical care. The PNA also collaborates with regular bodies like Professional Regulation Commission, or the PRC, and the Board of Nursing to set and update nursing standards, guidelines, and ethical practice, and advocates for policies to improve nursing care quality and competency. Number two, Critical Care Nursing Association of the Philippines Incorporation, or the CCNAPI. The Critical Care Nurses Association of the Philippines Incorporation focuses on critical nursing by offering specialized training, certification program, and professional development activities such as seminars and conference. It also sets standards in critical care nursing by developing clinical guidelines and protocols, working with healthcare institutions and other organizations to ensure high-quality care in critical care settings. Number three, the Philippine Heart Association, or the PHA, support critical care nursing by offering specialized training in cardiovascular care, including cardiac emergency management and advanced cardiovascular life support. It sets clinical practice guidelines for cardiovascular care and with other organizations to align these standards with international guidelines, ensuring high quality cardiac care in the Philippines. Number four is the Philippine Association of Critical Care and Medicine, or the PSCCM. The Philippine Society of Critical Care includes critical care nurses in the multidisciplinary training program and conference aimed at improving skills and promoting teamwork among critical care professionals. Also develops and promotes evidence-based clinical practice guidelines and standards for managing critical ill patients, ensuring that these standards are aligned with global best practice. Number five, Association of Nursing Service Administrator of the Philippines, or ANSAP. The primary support of nursing service administrators, but also address the professional development of nurses, including those in critical care through leadership and management training. ANSAP helps develop guidelines for nursing administration, influencing standards of care in critical care units by improving best practice in nursing management and optimal staffing.
Conclusion: Critical care nursing in the Philippines has evolved significantly, incorporating comprehensive medical and nursing care. Practices focus on the critical ill patient. The scope of critical care nurse practices involves multidisciplinary teams providing life-sustaining intervention in various settings such as ICU, cardiac catheterization, labs, and burn unit. So key points of developing of practices. Early beginning. Critical care nursing in the Philippines emerged in 1970s. Initially focused on managing patients with acute medication and surgical condition. So growth and specialization. The field has expanded significantly, incorporating specialized area like cardiac, neuro, and pediatric critical care. Technological advancement. The introduction of advancement of technology like ventilators, monitors, and imaging equipment has revolutionized critical care practices, focused on patient-centered care. So emphasis has shifted towards holistic care, incorporating patients and families' needs, and promoting patient autonomy. Challenges. The Philippines faces challenges like limited resources, uneven distribution of critical care facilities, and shortage of qualified nurses. So education and training. So formal education, critical care nursing educate is offered through bachelor's and master's degree programs in nursing with specialized courses and certification available. Continuing education. Nurses are encouraged to participate in ongoing professional development through workshop, conferences, and online courses. Simulation training. So, simulation training technology plays a crucial role in enhancing clinical skills and decision-making abilities. So, membership and preceptorship. Experienced critical care nurses mentor, guide new nurses for tearing professional growth. So, professional activities. Professional organization, the Philippine Nurses Association of PNA, and the Philippine Society of Critical Care Medicine, PSCCM, plays a vital role in advocate and critical care nurses and promoting professional standards, research, and innovation. Critical care nurses are actively involved in research projects aimed at improve patient outcome and advancing field. So advocate and policy. Nurses advocate for policy that supports patient safety, quality care, and well-being of critical care nursing. So international collaboration. Filipino critical care nurses engaged in international collaboration, sharing knowledge and best practices. So in short, overall, critical care nursing in the Philippines has evolved significantly, driven by the commitment and providing high quality care and critically ill patients. The field continues to grow and adapt to meet the evolving needs of the population with focus on education, professional development, and advocacy. That's all.
In addition, these ongoing developments in critical care nursing practice in the Philippines, based on the recent updates from the Philippine Nursing Association, the Critical Care Nurse Association of the Philippines Incorporated, and other organizations highlight the importance of continuous improvement in the critical care nursing, ensuring that nurses in the Philippines are well equipped to provide the highest level of care in the increasingly complex healthcare environments. First, we have the enhanced competency standards. These standards encompasses not only clinical skills, but also decision-making abilities, ethical practice, and patient advocacy. By adhering to these standards, nurses can significantly reduce the medical errors and improve patient outcomes, especially in the high-stakes environment of critical care. Second is the continuing professional development, or the CPD. The PNA, in collaboration with the CCNAPI, offers numerous CPD programs that provide the nurses with the latest knowledge and skills in critical care. These programs often include workshops, seminars, and online courses that cover emerging topics such as advanced patient monitoring systems, new pharmacological treatments, and innovation in the patient care protocols. The accredited CPD units are not only crucial for maintaining professional licenses, but also for ensuring that the nurses can deliver the best possible care. Third is the integration of advanced technologies. In today's healthcare landscape, the integration of advanced technology is no longer optional, but a necessity. Critical care nurses are expected to be proficient in using complex medical equipment such as ventilators, infusion pumps, and electronic healthcare record systems. CCNAPI's training programs now include modules that focus on these technologies, ensuring that the nurses are not only familiar with the operation but also understand the underlying principles. This knowledge is vital for monitoring critical ill patients, adjusting the treatment plans in real time, and ensuring that the technological errors do not compromise patient safety. Fourth is the ethical and legal compliance. The legal and ethical dimension of nursing practice are integral to the profession, particularly in critical care where decisions often have life or death consequences. The CCNAPI have been proactive in reinforcing the importance of the ethical and legal compliance through its guidelines and training programs. Nurses are educated on the latest laws, such as the Philippine Nursing Act, the RA 9173, and the ethical standards that govern patient care. They are also trained to handle sensitive situations, such as end-of-life care and informed consent, with the utmost respect for patient autonomy and dignity. This focus ensures that critical care nurses are not only technically skilled, but also ethically sound, which is crucial for the maintaining public trust in the healthcare system.
Number 5, career advancement opportunities. Career development is another area of focus with organizations like the PNA and CCNAPI offering structured pathway for nurses to advance their career. This includes specialized training that allow nurses to gain certification in areas such as cardiac care, trauma management, and neonatal intensive care. This certification not only enhance the nurse's skill set but also open doors to leadership roles within healthcare institutions. Number 6, focus on resilience and well-being. Career development is another area of focus with organizations like the PNA and CCNAPI offering structured pathway for nurses advance their career. This include specialized training that allows nurses to gain certification in areas such as cardiac care, trauma management, and neonatal intensive care. This certification not only enhances nurses' skill set but also open doors to leadership roles within healthcare institution.